Plantar fasciitis and Achilles tendonitis are two of the most frustrating conditions I see in my Houston podiatry practice every single day. And if you're dealing with either of these conditions, you know exactly what I'm talking about. My name is Dr. Andrew Schneider. I'm a podiatrist here in Houston, Texas. In my practice, I work with patients who are tired of just being told to stretch more or try different shoes when they're dealing with chronic heel pain or Achilles tendon problems that have been going on for months or even years. Today, I want to discuss a treatment option that's changing how we approach these stubborn conditions, the Remy Class 4 laser. But before I start, please like, comment, hit the subscribe button, and share on social media. This will help others find the information they need. Here's what's important to understand about plantar fasciitis and Achilles tendonitis. These aren't just overuse injuries that will go away with rest. These are conditions where the tissue has become damaged and stuck in a cycle of poor healing. The plantar fascia is a tough fibrous band of tissue that connects your heel bone to the base of your toes. When it becomes inflamed and damaged, traditional treatments often focus on managing symptoms rather than addressing the underlying tissue damage. The same is true for Achilles tendonitis. Whether you're dealing with pain at the insertion point where your tendon attaches to your heel bone, or inflammation in the middle part of the tendon, the real issue is damaged tissue that isn't healing properly. That's where the Remy Class 4 laser comes in. Let me explain what makes the Remy laser different from other treatment options you might have tried. First, this is a Class 4 therapeutic laser. That designation is important because it means this is a high-powered, FDA-cleared medical device. It's not a red light device that you see advertised online. It's not a cold laser that puts out minimal power. The Remy delivers up to 45 watts of precisely controlled laser energy using two specific wavelengths, 810 and 980 nanometers. These wavelengths can penetrate 3 to 4 centimeters deep into your tissue to reach the exact source of your pain and inflammation. Here's how it works. The process is called photobiomodulation. Think of your cells like batteries. When you have an injury or chronic condition, those cellular batteries can start running low on energy. They can't produce what they need to heal properly. The laser delivers specific wavelengths of light that stimulate the mitochondria, the powerhouses of your cell, to produce more ATP. That's the energy currency your body uses for healing. But it doesn't just stop there. The laser also increases blood flow to the treated area, reduces inflammation, and accelerates the formation of new, healthy collagen fibers. It's targeting the root cause of your pain, not just masking the symptoms. Now let's talk specifically about how this applies to plantar fasciitis. If you have plantar fasciitis, you know the symptoms. That sharp, stabbing pain in your heel, especially when you first step out of bed in the morning. You may feel pressure on your heel or may experience pain after you've been sitting for a period of time. Traditional plantar fasciitis treatment involves anti-inflammatory medication, stretches, orthotics, and ice. For some patients, these options don't bring relief, and they can still be in pain after weeks and months of treatment. Here's what makes the Remy laser different. Instead of just managing symptoms, we're actually stimulating your body's natural healing processes at the cellular level. When I treat plantar fasciitis with the Remy laser, I treat the entire plantar fascia from the heel insertion all the way to the toes. The laser energy penetrates deep into that thick band of tissue, reaching areas that naturally have poor blood circulation. The treatment protocol is straightforward. I'll have you lie comfortably, and I'll systematically move the laser handpiece over the entire bottom of your foot. You'll feel a gentle warmth. It's actually quite soothing. The treatment takes about 10 to 15 minutes. Here's the key difference. I can get immediate feedback on whether the treatment is working. I'll press on that tender spot on your heel before treatment, then after the laser treatment, I'll press on the same spot. In most cases, the pain is dramatically reduced or completely gone. That's not just temporary pain relief. That's your tissue actually responding to the treatment. Achilles tendonitis presents its own unique challenges. This can be insertional, where the tendon attaches to your heel bone, or non-insertional, affecting the middle portion of the tendon. The Achilles tendon is the largest tendon in your body, And when it's inflamed or damaged, it can significantly impact your ability to walk, run, or participate in activities you enjoy. With the Remy laser, I can treat both types of Achilles tendonitis effectively. The laser energy penetrates deep into the tendon tissue, stimulating cellular repair and increasing blood flow to an area that has limited circulation. For Achilles treatments, I'll often work not just on the tendon itself, but also up into the calf muscles. This comprehensive approach addresses the entire kinetic chain that affects Achilles function. What's particularly beneficial for active patients is that there's no downtime with laser treatment. You can continue your activities while the laser accelerates your healing process. This is very different from being told to stop all activity for months while you try other treatments. So what can you expect if you decide to try Remy laser therapy? First, the treatment itself is completely comfortable. You'll feel a gentle warmth as I move the laser handpiece over the treatment area. There's no pain, there's no needles, there's no injections. Each treatment session takes about 10 to 15 minutes. There's no downtime. You can walk out of the office and immediately return to your normal activities. For treatment frequency, I typically recommend a series of treatments. For acute conditions, problems that have developed recently, you might see significant improvement in just a few sessions. For chronic conditions like plantar fasciitis that you've been dealing with for months, I usually recommend 6 treatments. We can do these twice a week for 3 weeks or once a week for 6 weeks, depending on your schedule and your preferences. The important thing to understand is that we're not just providing temporary pain relief. We're actually stimulating tissue repair and healing. That takes time, just like any healing process in your body. Let me put this in perspective by comparing laser therapy to other treatments you might have tried or been offered. Physical therapy can be helpful, but it's often time-consuming and sometimes painful. With laser therapy, we're getting therapeutic benefit in a much shorter time frame, and the treatments are actually pleasant. Steroid injections can provide temporary relief, but they don't promote healing. In fact, repeated steroid injections can potentially weaken tissue over time. The laser strengthens and repairs tissue while providing pain relief. Anti-inflammatory medication like ibuprofen can help with pain and inflammation, but they come with potential side effects, especially with long-term use. The laser provides natural pain relief by actually addressing the damaged tissue. Surgery should always be considered carefully. With conditions like plantar fasciitis and Achilles tendonitis, surgery comes with risks and requires significant recovery time. Laser therapy offers a non-invasive option that may eliminate the need for surgery. The Remy laser can be used safely for patients of all ages. Because it's non-invasive, there are very few contraindications. It's particularly beneficial for patients who want to avoid surgery, those who haven't responded well to traditional treatments, or active individuals who need to maintain their activity level while healing. The laser can also be used in combination with other treatments. If you're already using orthotics or doing physical therapy, laser treatments can enhance these approaches. If you're dealing with plantar fasciitis, Achilles tendonitis, or other foot and ankle pain that's impacting your daily life, I want you to know that you have options. The Remy Class 4 laser represents an advanced approach to treating these conditions, one that addresses the underlying tissue damage rather than just managing symptoms. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. If you're suffering with foot or ankle pain and you want to explore whether laser therapy might be right for you, contact us at the office. We'll evaluate your specific condition and discuss all your treatment options. The link to request an appointment is in the description. Thanks so much for watching, and have a great day.